We are regularly speaking with experts on COVID-19 in the community, experts such as West Bloomfield and Tri-City Fire Department Fire Chief Greg Flynn, who now joins us on the Oakland County Megacast once again. Chief Flynn, thank you for being with us today.
Good morning.
Good morning. Good to have you on. How are you? How's the team at the fire department been?
We are doing well. I'm coming to you today from Station 1, 4601 Orchard Lake Road. We're just wrapping up our physical ability candidate test for some new hire firefighter paramedics. So you see quite a few trucks behind me and some of our staff here that's outside enjoying this. I think this is a much more beneficial camera shot than me from all the shadows and poor lighting inside my office. So it's good to be out here and showing our residents some of their firefighters at work and one of the fire stations here in the township, one of the 6.
Chief, you mentioned about some of the new recruits. For those people that aren't familiar with what it takes to become a member of your team, what is the recruiting process and what are some of the things that they have to go through?
All right, that's a great question. And public safety across the board, police, fire, EMS, have been struggling here. We had a big surge after 9/11, many people wanting to join the ranks of those in public service. And over time, that kind of has waned to the point where we're lucky to get 7 or 8 candidates. Myself, Chief Morin, you've had on the show from Bloomfield Township, Chief Menifee from Southfield, and I know the city of Warren has many vacancies in the rank of firefighter. We're looking, many of those agencies that I mentioned, we would love for the candidates to have their paramedic license already and to have their firefighter 1 and 2 training, which is provided at many of the community colleges here in Oakland, Wayne, and Macomb counties. And having those 2 credentials are ideal candidates, but we've even had to modify those to say, hey, we'll hire you as a paramedic, and then we'll send you to Oakland Community College or Macomb Community College to the Fire Academy for 10 or 11 weeks to get that certification. We're going to hire you, pay you to go, and then you'll come back and fully join the department here and go to work. So we've had to modify that because over time the desire to serve in those public servant jobs seems to have changed the trajectory and just doesn't seem to be as appealing to the masses.
Well, Chief Flynn, the appeal maybe has changed, but the need certainly hasn't. How critical is it for fire departments and other public safety institutions to continuously have these new recruits coming in?
Well, it's very important, Tyler. As you know, municipal governments work on a very refined budget, and we're very grateful for the taxpayers and the dollars that they pay to meet their expectations for the service that they get in return for those taxes. So when we have our budgeted positions lying vacant, delivering those services, we are much more innovative in how we have to do that. So when you take a reduction in the number of qualified candidates, you look back and say 25 plus years ago, hiring was good. So you have many people on the workforce that are becoming eligible to retire. Then we take a COVID pandemic layer and put on top of that, which is impacting those that may want to retire and those that may want to join public service. It really is this storm. I don't know if I want to call it perfect and jinx myself, because I'm sure they can add something else into the mix there, whoever that is. But it has made it challenging for chiefs across the state and quite frankly across the country to get qualified candidates that are coming into the field for the right reasons, to serve the public with a servant's heart, and to take these really good jobs. They really are a good job. In West Bloomfield, the township board here and the Tri-City Fire Board takes very good care of the firefighter paramedics here at the WBFD.
Chief Greg Flynn with us from the West Bloomfield Fire Department on the Oakland County Megacast. The fire department, of course, our Facebook partner on today's program, so we appreciate all you tuning in live via Facebook Live for the entirety of today's Oakland County Megacast. If you're just tuning in, you can tune in Monday through Friday, 10 a.m. to 12 noon. So, Chief Flynn, transitioning to COVID-19, the response has kind of plateaued a little bit. We've had case numbers that have mostly hit a plateau, a couple little spikes here and there. Give us an update on how West Bloomfield and the Tri-Cities are faring in terms of COVID-19.
Yeah, so I would agree with your assessment that the response has started to taper off, and so we remain in this mitigation and a kind of recovery phase, if you will. That doesn't imply that response is over, and I don't want to be misleading there, but long-term planning really is into mitigation and into recovery. And you're seeing that with, I'm sure you had County Executive Coulter on the show, and you talk about the CARES Act and how that money is going to local businesses and municipalities. That's part of recovery. We continue to see mitigation efforts where when you go into the local government office, you're going into the City Kego Town Hall, and you're seeing the plastic shields up, or at your local grocery store, you're seeing people being very respectful and wearing their face coverings. Those are our mitigation. Those are slowing the spread of COVID-19. And our communities continue to do an exceptional job at that. And I know so many news outlets, that's what I love about the MegaCast, is we get to give an accurate narrative of what's going on in our communities. And our residents are often doing the right thing. And I want to thank them on behalf of all the frontline workers, whether they're healthcare providers directly within our hospitals or our first responders on the street. Thank you for doing those things, washing your hands, your physical distancing, and your face coverings. That trifecta is our solution to mitigation.
So, Chief, you guys do paramedic as well as fire. Talk a little bit your response on the paramedic side. Have the numbers gone down? Are you back to responding to regular type incidents?
Ronnie, we have. I want to compliment too our dispatchers. That first link in this chain of survival of pre-hospital care is we're still screening all the callers, even on a house fire, even on an odor investigation or a smoke alarm. They're getting the information in, they're starting the response, and then they're asking that caller some key questions that may alert first responders to have a higher acuity for responding to that scene with additional PPE, or just with our standard safe response for our first responders. So we're doing well with all of that. And again, it's because our residents are forthcoming with the information. They know they're part of the solution, and that's what's making us successful. So I get a report every day that tells me the number of COVID positive screenings that we have. That's different than a COVID test. That's just our screening process. And we're seeing those numbers very low, somewhere sub 10 on a daily basis, which is really positive.
So with those numbers low, how, as a leader, is it for you to be able to keep that momentum going to the people that work under you, to remind them that this is still out there and to keep their guard up? Because you see it just like us in the public, people tend to start letting their guard down during this time.
Well, I think that's part of my role in the leadership team here. And the staff of firefighter paramedics that are here make our job easier because they're such critical thinkers. They know that this is when we become most vulnerable. As soon as we say, hey, some of these things don't make sense. I can wash my hands less. I can get closer to people. It just doesn't make sense. So they keep doing the right thing, just like our residents do. And that's our success strategy. I had a discussion with some colleagues the other day as we're looking at influenza season coming, that part of the speculation and part of our conversation is that we may be positioned very well because these social behaviors now, because it's not just a practice, these are behaviors. You probably notice now when you engage with someone in public, you naturally create space. This is now becoming a behavior. We've been doing it so long. That's going to position us very well for when influenza comes through. The very virus that we deal with every flu season, flu, influenza, interchangeable terms, we're going to be well positioned for that because we're doing these best practices. And I guess to loop right back there, as I like to sometimes navigate away from your questions, is that being a cheerleader for the team is an important role of all of the leaders within our local business and within community. And again, when you have a team that you're cheering on, that is the professionals like the men and women here at the WBFD and the WBPD, the Tri-Cities police departments of Orchard, Kego, and Sylvan, the job is made much easier when you're working with a group of professionals like these men and women.
Chief Greg Flynn with us. He's the West Bloomfield Fire Chief and the Chief of the Tri-City Fire Department, which serves Kego Harbor, Orchard Lake, and Sylvan Lake as well. With us on the Oakland County MegaCast, the Fire Department, our Facebook partners today. So Chief Flynn, transitioning from the fire department and the firefighter and paramedic angle of response to that of the community. We've seen recently more reports of spread of the virus through private gatherings such as grad parties and just individual parties, mostly with younger people as well. Can you speak to the community about the importance of, even in these times where people are celebrating rites of passage and sending people off to new opportunities, particularly with the younger people, how important it is to avoid those kinds of private gatherings, even with people that you're close with in life, to prevent the spread of the virus?
Yeah, and I need to walk a little bit carefully here because there are so many events that are so important to us, whether they're family events, religious events, community events. And really, I think the thing that we want to instill, in, first and foremost, is to abide by the governor's executive orders and completely support that. But there are times that come where families are coming together and you may be exceeding that number slightly. And one of the things that you talked about with before this interview was with Beaumont and changing some of their visitation policies for end-of-life issues and critical decision-making as far as medical care. We need to be thinking critically too. And there are going to be times that we come together. I have a high school senior this year. Our grad party was way different than what I grew up with or what my siblings what we had when any of my 5 brothers and sisters, when we threw parties for them. It's different, Tyler. And we need to acknowledge that and not hold on to the past and say, we're going to force the past into this pandemic. What we need to say is, what are we trying to accomplish? How can we accomplish and still make it great for this senior, a great anniversary party, a great birthday party, a great first birthday that we want our loved ones to experience it. And we just need to do it smart. And people need to not attend those things when they're not feeling well. People need to stay home and send a video message if they have a pending a COVID test or they're still symptomatic. We don't those things. But again, if we're healthy and we're keeping some physical distance and we're using hand sanitizer and washing our hands and we can space our chairs out and do something safely, we need some social engagement. We need a sense of community. We just need to do it in a smart way. So I'm walking gently here because I think what we as community leaders need to acknowledge is that our residents need a sense of community. And we've gone a long time without that. And so we need to find balance. And the community needs to understand that the leadership within government is trying to reduce and balance the spread of COVID. And so we need patience, we need kindness, we need compassion. And together we're going to be able to navigate this and find a path to keep our numbers low and have that sense of community and family and just that togetherness that so many of us are really, really, truly longing for, again, especially when you have weather like this.
We've definitely had a great summer, which is kind of added to everyone wanting to be outdoors. Real quick, I want to ask you a little bit about the budget. I know the CARES Act has helped kind of bridge that gap for some organizations. How are you guys on your budget, and do you think there's going to be a shortfall, or are you prepared for the next fiscal year?
I do not think there will be a shortfall. We've been aggressive on the CARES Act funding for all 4 communities that we serve. We have a great budget team here in West Bloomfield that is working with the assessor's office, working with finance, working with our elected officials. I think we are going to be well positioned with reserves and other dollars that we have out there to put the team together, keep our community safe, keep the service delivery there, keep building, keep permitting, keep all of these things going, albeit they may not be at the turnaround times and meeting all the expectations of pre-pandemic. The effort of all the department heads in the township and the other 3 communities of the Tri-Cities is to keep the communities moving forward. And I'm confident that we're going to do that as a team, with the community being a team member in that process.
So I know the big issue at the beginning of this was getting accurate PPE. I know the supply chain has loosened up. It's a little bit easier, but will you be prepared if there's a second wave? And does some of that PPE have a shelf life?
So we will be prepared. We were prepared on the front end of this for the initial round, where we noticed in our after action review that we needed an improve was the vulnerability of the supply chain. And so that in mind makes you readjust your reserve and the number of days you want to have that reserve for. For example, if we were assuming that our supply chain is a 10 to 14 day turnaround time, then one might assume I want 10 to 14 days of supplies so that I then can resupply them in a reasonable time. We're now extending that supply chain out, and we know that that can be influenced by high demand nationally, if not globally. So we're extending that. Supplies are starting to come in again. N95 masks are coming on the market at reasonable pricing. And so we're starting to replenish those things. As far as shelf life goes, I think there's plenty of credible white papers and research that on many of the PPE items that the shelf life can be extended if they're in the box, haven't been exposed to sunlight, extreme temperatures, so on and so forth, that would degrade the fibers within that protective gear. So I think that shelf life, if I understand your question correctly, Ronnie, is I would say that we can extend that, and it's safe to do so.
Chief Greg Flynn with us from the West Bloomfield Fire Department. Chief Flynn, just another few minutes with you before we got to let you go. Anything else that's important for our audience to know, for the people of West Bloomfield and the Tri-Cities to know, or anything else that you'd like to touch on today with us?
Well, I would like to start looking forward to the future a little bit, and preparing people, especially as there's so much discussion about going back to school. 2 points. Number one is that I don't want to forget about our educators. And I'm married to one, so obviously it's very close to my family. And just encouraging people to, again, be patient, as many educators are going to a full remote learning style, that educators be patient with parents as they navigate what that looks like. And just taking a breath as we all settle in, as you've heard me say before, when big events are coming up, like the start of school or shutting down the state and things like this, when we've discussed big things impacting the broader southeastern Michigan region, take a breath. The other thing I want to keep an eye on is, as we're moving into September, which is Suicide Prevention Month, is we start bringing some of those things, the casualties, if you will, of social distancing, physical distancing, this isolation, that we continue to see that need for emotional health and wellness. And I would encourage members of our communities to reach out to, if there's a suicide prevention line, to clergy, faith-based organizations, counselors. Don't let these emotional or mental health issues build up. We know that we have better outcomes when we address them sooner. And I'm going to be taking some steps here at the WBFD to highlight that into September, and hopefully we can talk about that more as we get closer. But that's an important, something we hold very close to our heart. When we lost Lieutenant Jeff Hiltner to death by suicide, our department is really taking a more proactive approach towards that, and that has led us to a more proactive approach within our community. And so I want to highlight that, and maybe, Tyler, that's something we can build into the program moving into September, as that is something very important to our community. We know that death by suicide is the 10th leading killer of Americans, and it has been in the 10th place for some time now. It hasn't moved. So it's in the top 10, and we need to take it seriously, just like we do with COVID, just like we do with heart disease, lung disease, cancer. It's very important, and I appreciate the time to highlight that today.
Well, we thank you for being out with us today, Chief.
Okay, take care.